Hello and welcome to the CSN3M Mindset Monday podcast. I am Andrew Wade with Case Specific Nutrition. On this channel, we focus on the 3 M's: mindsets, myth busting, and mentoring, all as they pertain to health and nutrition. I can't believe I'm about to say this, but this is episode 52. So if you are listening, today's episode, it marks 1 year straight of weekly Mindset Mondays on CSN3M. I'd like to thank everybody who's been listening so far over the course of the year. We've developed a great following and great viewer listenership. And I can't believe we're already coming here to the end of season 1. We've got some exciting things already in the plans and in the works for season 2. But with that in mind, I wanted to make sure we ended this year's season with a bang. So today's podcast is going to be a little bit different than what I've been doing mostly so far. Over the course of the year, you've heard a lot of me, and you've also heard quite a few of the dietitians on our team. I've interviewed our core team members, our marketing intern, and about 4 or 5 of the other dietitians on the team. So today we are going to go a little bit differently, and you're going to get to hear from the directors of Case Specific and the Case Specific brand. And we're going to talk a little bit about some of the things we are doing here at Case Specific and how these services are meant to help and engage people, who they're meant for, and some of the ambitions and visions that we have in trying to change how millions of people perceive and navigate their own individualized health and wellness. So with me today, I have my right hands, so to speak, in Vince Ranalli and in Marty. I'm going to interview them a little bit. We're going to go back and forth with some of the cool things we have going on here within the Case Specific brand. But for now, welcome Vince and Rob.
Thanks, Andrew. Excited to be here. This is Rob speaking.
Thanks for having me here, Andrew. This is Vince, newer to the team, but happy to be here and joining in.
Absolutely. So those are the voices. You've got Vince and you've got Rob. Vince is our Director of Community Engagement, which we'll dig into what that is and what that means and what that does here in a little bit. And Rob is our Director of Operations, which sounds very big and encompassing, and it's because there's a lot of things, and you'll learn why I rely so much on both of them here soon. But we've got a lot of fun things going on. For those of you who don't know a lot about the Case Specific brand, I am a registered dietitian, obviously, which is usually pretty apparent through this podcast, and we are a private practice, and that was the base or foundation of the business. But over these last few years, we've expanded our brand beyond just the standard private practice to really try and make an impact in people's lives in a variety of ways. So under the Case Specific brand now, we have our Case Specific nutrition dietitians that do nutrition counseling, both in person and virtually. We have our corporate wellness arm where we work with businesses and organizations. We have our online course, which is the Optilife Academy, which is a do-it-yourself wellness program. We have the diabetes prevention program, which is a 1-year-long preventive course that engages habits and healthy lifestyle. We have Case Specific Wellness, which is our training facility that has strength and conditioning coaches. And then we also have our Case Specific Meal Prep, CSMP, which is our local meal preparation and delivery service that creates dietitian and chef-inspired meals delivered straight to our clients' doors, as well as some of the corporate wellness groups that we work with. So we've been working very hard as a team over these last years to create a brand that is able to reach our clientele, serve them in a very genuine way, and meet them in a very individualized format, whether it be on their own time in the form of a meeting, in the form of a group class, or in a corporate wellness type setting. We are here to do it. And so I want to take some time then to sort of let Rob and Vince here talk a little bit about some of the things that we do. And so I'm going to hand it off to Rob a little bit to talk a little bit about what he's done and what he does within Case Specific, specifically relating to our internal services. So our dietitians, how they counsel, how they connect, how we're working harder to meet with and set people up to succeed. And then also he's going to dig into our corporate wellness structure that we've been utilizing and developing here over these last couple of years. So Rob, Director of Operations, talk about operation. What is it about?
Thanks, Andrew. My primary role is letting the dietitians dietitian, and that sounds very cheesy, and I get a giggle out of Andrew. But when Andrew and I spoke about me joining the team, my background has been health and wellness. It's something I'm extremely passionate about. And also office administration. I spent a little over 3 years in Ohio working with adults and children with intellectual and developmental disabilities. And that's your Medicaid and your Medicare fields, which for those of you who aren't familiar, it is very challenging to get the services necessary for those adults and children to be covered. Medicare and Medicaid is not the easiest insurance to work with. No insurance really is. And I spent that time learning how to be efficient and how to help those families get the services that they need. And so when Andrew and I sat down and talked, the conversation was very similar. How do we help our community receive the services they need in a timely manner? How do we increase the likelihood that insurance is going to cover by double checking codes and making sure that it's a seamless, convenient process? How do we make insurance understandable and digestible for our clients so that it's not a burden to them? And then on the other arm of that, how do we make it easier for our dietitians to dietitian? And we do that by removing anything that would distract them from you, the client, the person that they're sitting across from virtually or in person, to ensure that they get to talk to you about your health history, your goals, your dietary needs, the foods that you like and you don't like, your labs, your chronic diseases, diabetes, eating disorders, and the very large number of chronic disease and health and wellness goals that we work with. How do we ensure that that's their focus and that they're not dealing with office stuff? And so we've now been working, I've been a part of the case-specific nutrition team for a little over 10 months, and we've come a long way, but we have a long way to go too. COVID taught us a lot. Telehealth and virtual appointments are convenient. People do respond positively to them. It allows our network of people that we're supporting to extend outside of our immediate offices, and we hope to continue to provide that service throughout 2021 and going forward by working with your health carriers to be contracted to provide that. And that's what I do. I joke that when I was with the home care group that supported people with special needs, I joked that I was everything but the nurse. So anything that wasn't giving an injection or supporting that family directly through the care provided, I did it. And I do the same thing for case specific. I'm not the dietitian, but I'm pretty much everything else to figure out how we make this a robust, person-centered service so that your experience is not only the great dietitian service that we know that we provide, in addition to the other services that Andrew mentioned and that Vince will discuss, diabetes prevention, CSNP, Optilife, but also that as you get onboarded, as you reach out to us via Facebook or Instagram or our website, as you call our office, that is also a very positive experience, that our customer service is just as amazing as the team of dietitians that you're going to meet with. And we're achieving that, and we're always looking for feedback. So for those of you who are listening who have met with a dietitian or who are considering doing so, we want your feedback on all of the steps leading up to meeting with the dietitian as well. We're constantly looking to improve, and that's the case-specific nutrition brand. Our service is the dietitians, the food, the diabetes prevention, but we are equally proud of our customer service and of your experience leading into those services. So always looking for feedback and to grow. Another thing that I would note, and I am a huge fan for anybody who enjoys audiobooks or picking up a book, Dr. Vivian Lee wrote The Long Fix, Solving America's Healthcare Crisis with Strategies That Work for Everyone. And this is near and dear to my heart because I saw how the health crisis affects people with intellectual and developmental disabilities and that they could not receive services. Case-specific nutrition is built on the philosophy that you're going to know the cost associated with our services in advance. There is no random billing, there's no copay, no deductible, no service that you're not going to know in advance. We check all of that so that you can make an educated decision. And yes, we want everybody to take advantage of our services, but we understand if the reduced out-of-pocket rate or your deductible means that financially you can't do that right now. But it is our job to make sure that you're aware of that in advance so that you're not receiving a bill after you meet with one of us that you can't afford. And we take a lot of pride in that. Yeah. So we hope that as you would call us and interact with us, always communicate those concerns, those limitations, because we are here to work with you. And we are constantly, as Andrew has said, looking to expand how we support our network and the people across the country who need reliable, person-centered nutrition supports. And that means working with your insurance carriers, like I've mentioned, working with nonprofit groups and different funding sources to continuously argue and show outcomes so that our services are extended and those covered services are better provided, more easily accessible, etc. So we are always looking to improve on that note, and like I've said again and again, always looking for feedback. So there is no risk to contacting us and to inquiring about services.
Yeah, no, thanks, Rob, on that. And I echo all those things completely. But what we can think about too is that, you know, the initial base concept of case-specific nutrition was to help each individual that came through our door define and find their definition of health, and then work with them to sort of, you know, through that journey, through gradual improvement, through getting better and better. And with that sentiment, with the desire to help challenge individuals to find their health, to find their wellness, to find their well-being, we take that seriously internally too. We look at our team, we look at our methodologies, our strategies, our operations, and we're constantly looking to improve, which is why what Rob alluded to, our work in, you know, initially when it was mostly, you know, a couple of years ago, when we worked a lot with people that were pretty much covered by their insurance. And while insurance coverage is very good, we're now trying to figure out ways that we can better support and better engage people that don't have access, that don't have the great insurance, that don't have the great coverage. The goal of helping as many people as possible is a big one. It's a large goal, big, hairy, audacious goal, but it's the only way we know how to do things, is to continue to get better and better, just like we encourage our clients. And as we get better, be able to take on more and more. And with that, we can hear that there's a lot of other branches within the case-specific family that we've continued to reach out to. And one of the paths that Rob has really helped us with is through the corporate wellness engagement. And that is one of the ways that we're trying to engage clientele that might not, know that they have access to dietitian services, might not know what type of dietitian they might benefit from seeing, or some of the things that they could work on, might not have that within their personal or private life. But then we can work on engaging with businesses that are passionate about caring for their employees and be that support, be that option for them. So do you want to talk a little bit about case-specific, like corporate wellness, so to speak?
Yeah. So I would pose this as a call to action for anybody who works in an employer group of any size, be it you're an HR director, or you're a front desk within a healthcare facility, you're a physician, you're a nurse's assistant. You all have the ability to question what services are being provided to our group. Whether you're a physician, we're constantly looking to partner with our healthcare providers so that we're a convenient, referral, easy, accessible resource to our doctors, so that you're not trying to have the nutrition conversation in your amount of time, that you have a group that you can trust and refer to. And for HR directors and businesses with wellness programs, same thing. I tell groups that we work with to think of us just like you think of a dentist or an eye doctor. You encourage people to go out and do that, and you have a health fair where you bring in local vendors so that people can have their insurance checked and know that they can go and do that. And dietitians are the same. We are just as important as having your teeth cleaned and your eyes checked, because you know that those are connected to long-term quality health. And having somebody who can sit down with you and look at your diet and help you identify why you have fatigue, why you're achy, reasons for, getting lightheaded, or why you can't lose weight, hormonal deficiencies. It's no different than those core services that we always kind of think of: PCP, dental, and eye. The fourth should be nutrition, and we will work with your business or your healthcare group to make this a convenient referral source. We can show you the outcomes that we've experienced with our other partners, and that's how we're based. Referencing that book again, The Long Fix, it should be outcomes based. If our services didn't help people lose weight, didn't help them increase their energy, didn't help them with their eating disorder or their wellness goals, then we would be a dinosaur, and we wouldn't be here, and we wouldn't be seeing 200 referrals a month and growing every single month over month. But we're not. We are outcomes driven. You're going to have results with us because it is based off of your individual needs. And so long as we're doing that, we are the partner that can help your group with their wellness program, your physician group with nutritional needs, whatever that looks like. It's very easy to get in contact with us. Our main office line, which Andrew always mentions, and our website, 412-593-2048, and my extension is 5. Our main office extension is 1. And then casespecificnutrition.com, my information's on there. Again, this is Rob. Reach out to us. Ask. It doesn't hurt. There's no risk. We can tell you if there's something that we can do to better support your group, be lunch and learns, health huddles and accountability groups, virtual or in-person sessions. I went to a school the other day. As we all know, schools are going through very stressful times right now, and we did a stress management and breathing technique through progressive relaxation to help their teachers kick off their school year, because the school year is going to be a little more stressful than normal, and it's always been stressful. And I think a lot of times groups, especially HR directors, my heart goes out to you guys, because you wear a million hats. Let us wear one of those hats. Let us be a partner and let us help out.
Yeah. No, thank you, Rob. And what's to recap with what we're doing within the private practice, becoming more accessible, more efficient, and within the corporate wellness side of things, is it really captures that dietitians are kind of a unique profession right now. And I don't think a lot of people recognize this, but dietitians are educated in chronic disease prevention and management, diabetes, hypertension, high cholesterol, reduction of risk of heart disease and diabetes. And then they're also trained in motivational interviewing and habit creation. And so the dietitians on the case-specific nutrition team have a skill set that allows really good time and energy and effort to be put towards changing someone's health and wellness. And where this becomes so vital is when we think about the current medical model of care that exists, doctors are completely overburdened with patient load, right? How many of you have gone to your doctor, spent 5 minutes with them, felt like you weren't heard? And that doesn't mean that doctor is a bad professional. In many ways, it's the model in which they have to work. And what's really interesting is when you look at the world of chronic disease, those are preventable illnesses that are more related to lifestyle habits, which means prescribing medications, spending time in your PCP's office is literally a waste of their time. That really would be better served working with a preventive specialist, someone that went to school for 6 or 7 years to focus on the habits and the lifestyle modifications, as well as the motivation and inspiration of creating long-lasting change. And what's cool to think about is in the vision and model of case specific is for us to give access to dietitians so that more and more people are going to a dietitian to work on their blood sugar, to work on their blood pressure, to work on their cholesterol levels. And because they're working with the dietitian, they're not having as many appointments with their PCP, which means the PCP can free up extra time and then be dealing with acute care, people that have acute illnesses, issues, viruses, bacterial issues, fungal infections, whatever it is that they specialize in, which allows them to be better at their job. And so in this model of care, the ambition of case specific in many ways is to take the burden off of the biomedical model so that it can do what it's supposed to do, which is treat acute illness, while we take the brunt and carry the burden of managing and preventing chronic illness and doing that through positive lifestyle change. And so whether it is our private practice and we're working with doctors' offices trying to be that resource for them, or whether it's our corporate wellness, where we're trying to engage with city or privately held companies that are working with their employees to try and improve outcomes. We are there to be that piece, to be that baton, to be that thing that gets passed along. And where Vince comes in, because Vince has been quiet so far in this podcast, is some of these new additions, which I alluded to earlier in the form of the diabetes prevention program, which is our next piece of chronic disease fighting out of the medical model, but still clinically valid, peer-reviewed, and there to support doctors' offices and businesses. So Vince, will you talk a little bit about what DPP is, who it's for, what the research or clinical validity behind it is, so that people can understand why in our vision of chronic disease preventers, of lifestyle navigators, we saw DPP as such an important opportunity to bring to the table?
Absolutely. And, when we get into this, the reason that this program is so near and dear to me is when I got into health and wellness, I had grown up a very overweight child. And as I went through schooling, I wanted to understand nutrition. I wanted to understand health and wellness on a greater scale. And as I went through my career and I continued to work with doctors and I continued to work with fitness and wellness professionals, I kept finding that people would go through their lives only to find out too late that they had a chronic disease. It wasn't prescribed to them. They weren't told that they were pre-diabetic, that they had hypertension. And all of a sudden they're dealing with these ramifications of a lifestyle that they could have changed earlier on. They're now on medications. They now have to adapt their lifestyles when simply some physical activity and some of the food that we eat could have drastically changed that. And through my time in this world, working through that, I've never been in a situation like I am with case-specific nutrition to fully engage the participant, whether it's one-on-one with a registered dietitian, whether it's through a diabetes prevention program like we'll speak about in a group setting, or even through some of the wellness that's offered in the corporate health. So this program really means a lot to me, that we are able to work with you to stop these chronic diseases, specifically type 2 diabetes, before it starts. One of the stories I'll go back to that happened to me a few years back was a gentleman who had taken the class, decided that it wasn't for him, and met up with me a couple years later, and diabetes had progressed so far for him that he had to go and see a doctor to do dialysis 3 times a week for 3 hours each time. And his comment to me was, if I would have spent time on myself, I would not have to see and go sit in this location to have dialysis for 9 hours a week, simply doing those walks. And that story hits home to me that we can make these changes. I know that it's going to be difficult in some respects. We have to change some habits that we have. We have to increase our physical activity, but we can stop the medication before it starts. So let me get into this program a little bit. So we know that 1 in 3 Americans are pre-diabetic. There is a huge percentage of us out there that fall into this category. And when we look at some of the statistics, if you know your blood values, A1C between 5.4 and 6.4, fasting plasma glucose levels between 100 and 125, and a BMI of roughly 25 or greater, qualify you for this program and qualify you as a pre-diabetic. Now, if you don't have those blood values, when you go to see your PCP during your regular visit, they can give those to you. There's also a risk score that we have on our website that you can take from the American Diabetes Association and from the CDC. But this program comes to us from the Center for Disease Control. It's a year-long program, so we meet for a total of 25 sessions. During those sessions, we will talk about nutrition, physical activity. What do you do when you go out to eat? What do you do when you go to these events? How do you handle the holidays? How do you handle stress in your life? We all have so much going on, COVID not even included, that we're trying to balance kids, grandkids, retirement, work, and how does health and wellness fit into our lives? One of the things that I say in class all the time is this is one of those times we have to be a little bit selfish. We have to be looking for ourselves. And Rob and I have a program going on that we work with a bunch of nurses right now. And those nurses are incredibly passionate about what they do and spend so much energy working with those clients that they don't always see that they need that for themselves as well. So we talk a lot about that. We do have in-person programs, but we've switched to mostly virtual for now. So you can take this from anywhere. Even if you're not in Pennsylvania, you're welcome to join in our class. If you are interested in learning more, I'm happy to talk. As Rob said, my information is on the website. You can give me a call, shoot me an email. Some insurances do cover this program. We can talk through all of that. We do have some other discounts available if your insurance does not. So what our core is there's 2 goals with this program: 150 minutes of physical activity as well as 7% weight loss. The CDC has found that the 7% weight loss can reduce your chance of type 2 diabetes by 54 to 75%. Higher percentages are for seniors over 65, but still, those percentages are huge for doing some of this work. And again, we're not asking you, once you join this program, to dispose of everything in the house, go through the cupboards. You're not going to the gym to lift heavy weights 30 minutes or an hour a day. Simple, slow progression as we continue to work. We love to see that other aspects are taken advantage of, like working with a registered dietitian while doing that. But I've seen amazing health benefits with this program. Simple, slow, steady designed work to get us where we are. Individuals coming off of blood pressure medication, coming off of cholesterol medication. Some come in that are already recommended metformin or are moving towards that direction, and we've been able to reverse that. So I highly recommend this program, something that I've worked on for the last 6 years, and something that I really see a benefit with. And having the CDC certification and backing is something that means a lot to us as well. We have a lot of professionals in this world that are able to do that with us. So again, if you have questions, I'm happy to answer those. Bring that up to me. Shoot me an email. We can go through how you get into the program, taking the risk assessment, and what it's all about.
That's so exciting. No, thanks for giving the overview, Vince. It's a lot to take in, like you said, but it's so valuable, and I think Rob has a couple thoughts on it too.
I just wanted to have Vince repeat the weight percentage again, because I think that that's so important. Again, I spoke a lot about outcomes and how that's what we're driven off of. This program is outcomes driven. 1 in 3 people, 1 in 3. We're sitting in a room right now, Andrew, Vince, and I, 3 people. So theoretically, one of us could be pre-diabetic. And then, Vince, would you say again the amount of activity and the correlation between 7% weight loss and risk reduction?
Yes. So 150 minutes of physical activity is our goal. Again, it's slow progression. If you are sedentary right now, that does not mean next week you jump to 150. We look at 5-10 minute increments as we start to move forward and move up. We do what you like. If you hate being on a spin bike, we don't recommend going to a spin class. We want you to feel comfortable. Do you like to walk? Do you like to play sports? Is that something that works in with your physical activity? We also have 7% weight loss as one of our goals. So the CDC has found that 7% weight loss, again, over a year's time, not a huge ask, reduces our chances of getting type 2 diabetes by 54 to 75%. Huge outcomes for things that we can do. We talk about some minimal adjustments in your day. Do you tend to park closer when you go to the grocery store or go out? We try to find some different things. Parking further away, making more steps, using the stairs instead of the escalator. All these different types of ideas that we can work towards a healthier us.
Yeah. And what I want to make sure I capture on that is 7% weight loss is not a huge weight loss, right? I mean, that'd be 14 pounds for a 200-pound person, be 21 pounds for a 300-pound person.
Over a year.
Yeah, over the course of a year. It's not a weight loss program. Now, weight loss is a very common side effect, and I know a lot of people that do the program end up losing quite a bit more than the 7% if they need to. But what we want to recognize here, the reason why DPP fits into the case-specific vision is it's really meant to be a class version of a personalized approach. So Vince or the coach that you work with is going to be the individual that's helping guide you through habits. Like Vince said, finding ways to move that you enjoy, working on navigating your life and how food fits into that life. The goal isn't to avoid life. The goal is to learn to surround it. And that's exactly what the dietitians do at Case Specific. We work one-on-one with people and help them navigate their life and optimize things. And if their body gets healthier and their choices start to become more in tune with themselves, right? We connect with that why. Why are we doing these things? Health improves over time. DPP is a group version of that. It gives you the accountability, gives you the partnership, gives you the camaraderie, whether it be in person or virtual, and it allows you to have those discussions and, again, work on yourself in an intentional way. But it's meant to be for those people that are looking to make long-term health changes and let their body benefit from it.
And Andrew, to that statement, I do want to make sure that there's always such a stigma behind this prediabetes term. Let's get past that and move so that we are being more conscious of our health and wellness. When we look at this, I find that you bring up the word or the disease cancer, and it has such this drastic negative stigmatism. And when people bring up type 2 diabetes, it doesn't seem to have that. And when we look at this, we're looking at the loss of vision, the loss of nerve feeling in our bodies, amputation of body parts because of this disease, liver, organ failure. This is a very serious disease, and something that if we get past that stigma and past that word and can get into programs like this, I don't even care if it's with us. I just want it to be something where you're being more conscious about health and wellness. We can stop all of that. We can stop shots. We can stop insulin, metformin, and it continues to progress to a point where we're going to be dealing with a lot of negative consequences. So, to your point, we are looking at weight loss. We are looking at increased physical activity. But at the end of the day, we want to keep you out of the hospital. We want to keep your medical bills low or non-existent and get you off any current medication that you're on. The last thing we want to see is you heading to the doctor and now there's another pill to take. There's another prescription to go pick up. There's another copay to have. When you look at this program, it is about reversing that. And that is why I love this program so much, is we are not pushing medication. It is about home remedies, getting your nutrition in line and getting your physical activity in line.
Yeah, well said. And it fits in the vision. So whether you're interested in working with someone one-on-one, whether you want to have that group camaraderie, or in an ideal world where you have both, that is, some of the things that we've been working to try and build and create and, make available for people through their own, their own insurances, or also through some of the businesses that we work with. So in addition to the DPP program, we also have one other program called Optilife Academy, which is a course that I built with a strength coach I'm very close with over the last couple of years. And it's optilifeacademy.com. I've talked about it a little bit on the podcast before, so we won't spend as much time on it. But just know that it is available as well, and it goes through nutrition and fitness, talks through habit creation, how to navigate food in a positive way, how to make small changes that have benefit to us long term. And it's really easy and accessible. If you have internet connection, you can absolutely hit it. And anywhere with Wi-Fi or anywhere with 4G or 5G, you can log in, watch the short videos, read through the content, use the action sheets, and over the course of a month, it's meant to shift and shake your perspective. And that's really the goal here, is we're always trying to help people get a refreshed perspective, get a renewed sense of purpose, renewed sense of vigor, and a renewed sense of excitement about their own choices and their own health and well-being. And so we've got the Optilife Academy for you. We have the DPP program. We have our core dietitians that are working on making changes and working with people in a very personalized way and working with families. And all of that now gets paired with one of our newest features, which is case-specific meal prep. Vince and I are actually partners on this. So case-specific meal prep is something that I've wanted to do for a very long time. I've had a couple food and restaurant related individuals reach out to me over the years about the concept of it, and I was always a little hesitant. I wanted to find the right fit, and when Vince and I sat down about 2 years ago to first start talking through it, he had an idea, he had a vision, and it was very, very quick before we realized that there was an alignment that him and I could collaborate on. There was a way that we could integrate, our dietitian's knowledge, our experience with food, our experience with the food delivery industry, our experience with people needing meals, and pair that with a chef that we had as a mutual colleague, and Vince's understanding of business and his network. And there was going to be a great way for us to be able to create something here locally in this, right now, this Allegheny County area, expanding to Western PA, and we'll see how it grows from there. But Vince, do you want to tell them a little bit about the day in and day out of case-specific meal prep? Because to be honest, for those of you listening, my part of it is I help troubleshoot and think through some of the food ideas. I'm important for the nutritional values and the making sure the meals are nourishing and consistent. And then as the dietitian that works with hundreds of people and has worked with thousands of people over the years who have used meal delivery services, I'm sort of that back-end insights and thoughts for the rest of it. But Vince is the guy. He's the one that's running the day-to-day. He's the one working with Isaac and getting those meals in, made and sourced and delivered, and then obviously consumed. So tell them a little bit about your side of CSMP and why we're so excited about what it's been doing for hundreds of people here locally.
Yeah, absolutely. And if I could be more excited about the diabetes prevention program, this one's just a slight up there. So, when Andrew and I sat down and talked about this, I think I brought with me all of my frustrations from my growth in the health and wellness industry. I've been a personal trainer. I've ran gyms. I've done corporate wellness. I've done chronic disease prevention. And in every scenario, there's always a missing piece. Whether you're willing to come in and start working with a personal trainer, do group exercise, go meet with somebody to talk about education, the last piece is always, how do you fit that in at home? And there's so many entities out there that allow us to support us in our gym go. Maybe it's Silver Sneakers that pays for your membership. Maybe it's education like diabetes that your insurance covers. but where is that food education other than meeting with a registered dietitian? And Andrew and I sat down and I said, look, I've met and worked with so many people over the years. The missing piece is food. How do we make this happen? And, you know, we talked about the others in the industry right now and what they're doing. How can we be this next level? And we knew that first and foremost that Andrew and his team of registered dietitians were that answer. There's not many, if any, out there right now that have a team of registered dietitians that can create macros and create this nutritional guideline for us that is being passed off to our clients. Next was, how do we make this affordable, and how do we have that high level of quality? We somehow stumbled upon Isaac Saunders, who is an amazing chef. I mean, years of experience. He's traveled all over the world and really brings a lot of flavor and a lot of different experiences with him into these meals. And then we figured out what we're still working through is our cost basis and keeping those meals relatively inexpensive for you so that you can make this work with your day-to-day. So we've had this going for about 6 months now. You can check out our website. It's a part of Case Specific Nutrition on there, csmpgh.com, and really see how this all came together. The pictures on there are amazing. Seth does our graphic design. He's incredible. But, you know, we open on Sundays at 5 p.m. The website is available to you until Thursday at noon when we close. When we close, we do that so we can order our proteins, our produce, and get our cooking done. And the reason that closes is because we want fresh products to you every single week. So we cook on Friday and Saturday. We deliver to homes on Sunday. We deliver to businesses and gyms on Monday. And every week you get these fresh meals, never frozen. They are plated out on Saturday. I mean, every meal goes onto a scale. Rob is well versed in that. He's helped out a lot with that. And every single meal is scaled out so that it fits your macros and that we're meeting those criteria. We have everything from white rice and broccoli with your choice of protein up to some of these dishes that I never would have imagined I would have tried, you know, that Isaac has brought. These we have greens and cornbread with these pork chops. We've got succotash. We've got quinoa and roasted Brussels sprouts. And the flavor is just the sauces that he pairs. One of my favorites is the teriyaki. He uses bananas so that the sugar content is reduced. All health and wellness is imagined in these foods. We're looking to launch breakfast here soon. We have a partnership with Bake True North so we can offer gluten-free desserts along with this. Nice, small, compact item so that we can still have some of that sweet tooth flavor along with the health and wellness that we're doing. And as we grow, you know, we want to continue to expand, but to Andrew's point, we never see this going nationwide. We always want this company to be here in Pittsburgh to serve you fresh foods that are ready to go every single week. So I would encourage you to check out the website, see what that looks like and how that fits for you. Reach out to us if you have questions about it, how these fit into your macros, how Andrew and the team came up with some of these designs. And I really love the pairing of having a registered dietitian recommend these meals and how they fit. Of course, if you're just doing this on your own, we'd love to have you either way. But really excited to see where this goes, and any feedback if you're a current client or looking to jump into this of how we can improve.
There you have it. So that's our status update, right? So that's what Case Specific is. That's what the Case Specific brand is about. That's what we're building and developing and becoming. And just like when we work with our clients on incremental steps to change, consistent and persistent improvements day by day, we ourselves internally are doing just that. We're looking every day, every week, every month at all of our meetings. How can we make a bigger impact? How can we make a better impact? How do we give quantity while improving quality, not losing quality? So whether you are looking to meet with a dietitian in a virtual office or in an in-person office, whether you want to get involved in a group class that keeps you in tune with yourself over the course of an entire year, whether you are looking to log into an Optilife portal late in the evening to watch a couple videos and start thinking about your health a little bit differently, or whether you're looking for that Tuesday, Thursday night soccer practice chaos dinner solution, we're working to deliver those things to you you in a way that's positive and supporting. And we're always looking for ways to improve on those things and expand ideas. We like a good challenge. So for those of you listening, whether you have a business in mind, whether you have a family member in mind, whether you have a group in mind, or you have a concept in mind from a health and wellness perspective, what can we do to better serve the population? How can we genuinely help more people define their health and go on their journey? I'm really proud of this team and the group that we've developed over these last few years. I'm excited to see what we can accomplish, and we want to help you in any way we can. So please reach out to us, challenge us, let us help you, and let us find ways to make an impact and truly spread the health, which has been the hashtag of this podcast for the last 52 weeks now. We have been on a hashtag spread the health campaign. And so I wanted to end that campaign with helping you see some of the ways that we are trying to spread that health, whether it be our content, our media, or whether it be our actual interventions and day-to-day business operatives. We are excited to connect and learn and grow, and we promise that we will go into this next year and this next season looking to get better every day, just like we challenge the people that we work with to do so. I want to thank Rob and Vince both. Thank you guys for being with me on the podcast, sharing your backgrounds, sharing your passion, and thanks for also sharing that passion with me every day as we dig into this and we try and make the world a better place. Couldn't be prouder and couldn't be more humbled to have such a great group of people surrounding me. Any last words from either of you before we give these people a chance to rest their ears and get on with their day?
Just reiterating the call to action. You don't know how you can benefit, what your group is able to do as an employer, the services that could be implemented. It doesn't hurt to have that conversation. And as we've made it through several months of COVID and people are getting, I don't like using the new normal, but as we've adjusted and we've built our foundation back up, let's challenge ourselves to build the foundation deeper than it was before. And let's do that with preventative wellness and outcomes-driven resources. Let's recognize, as Vince said, that many of us are driven to give to others, be it our families, our jobs. Let's be selfish. Let's give a little to ourselves, because when we do that, when you take time to reinvest in yourself, your health, your mental well-being, your nutrition, your exercise, you're going to be able to give 10x, 100x what you could before. When you're tired and you're trying to remember to take medications to manage chronic disease and you're struggling with motivation and purpose, you can't live up to the potential that you want to, that we all feel called to share and to give. Let us help you be selfish. Let us help you rebuild that foundation. And as we go into 2021 and we end this podcast, I would remind you that you are unique, your health history is unique, and the services that support you should also be unique. And we hope that you'll give us a call and let us have that opportunity to serve you.
Mic drop. I couldn't say it any better myself. So unless you have anything else, Vince?
No, it's great to be here. Excited for 2021, and hope to get to meet and serve some of you guys on this podcast.
I love it. So thank you again for listening. Thank you again for listening throughout this year. I've been amazed at the hundreds of people that log on to this podcast every week. It's been really, really neat to be able to support that and create another avenue that hopefully helps people navigate their own health. I'd like to thank you for listening and remind you to please subscribe to this channel. And don't forget to share this. Friends, loved ones, social media posts. Give this a share, tag somebody. And don't forget to do your part by hashtagging Spread the Health. As always, for more case-specific nutrition content, you can check out our website, casespecificnutrition.com. You can check us out at Case Specific Nutrition on all social media. And again, this is the first time that I say we will not be back next week with another Mindset Monday. We're going to take a 6-week hiatus. We are going to rest during the holiday season. We're going to share some of our favorite podcasts over the last 52 weeks. We're going to plot and plan and prepare to come back better and stronger in January. So we will expect that first week of January will be podcast 1 of season 2, CSN3M. And so until then, be well and continue to try and move your own personal wellness a little bit better every day. Thanks for listening.